Okay, so we will make a start so that we don't end up running behind. So thank you so much, everybody, for coming along today to the EAZA Animal Welfare Webinar. Apologies for the slightly last-minute change of platform. We've had some difficulties with Zoom. Please, if you are just joining us, you're very welcome to have your cameras on, but please keep your microphones turned off. It just means that there's no interference on the line whilst we've got the call going. So it's my absolute pleasure today to announce that we're joined by Dr. Heather Bacon. Heather is going to be talking to us about pain in zoo animals and thinking about some of the challenges in relation to that and also opportunities for better welfare. So Dr. Heather Bacon is a vet and she is Dean of the Veterinary School at the University of Central Lancashire. Heather's worked on a number of different projects. She's worked internationally on veterinary education and animal welfare projects as part of her work within the university, and she's also worked as a veterinary director of Animals Asia, which is a charity committed to ending the trade in bear bile. So Heather is at the moment wearing many hats. She's the chair of the World Small Animal Veterinary Association's Animal Welfare Committee. She's a member of the EAZA Animal Welfare Working Group, and she's also a member of the BIAZA Bear Focus Group. Alongside all of this, Heather works as a UK zoo inspector, and she's a consultant to several zoos and charities on behaviour and welfare issues. Heather's interests include changing human behaviour to improve the welfare of animals and also using education to develop effective veterinary skills. So thank you so much, Heather, for joining us today. I'll pass over to you. Thank you.
Thanks very much, Ellen. I'm delighted to be here today and a huge thank you to the team at EAZA for giving me the opportunity. We'll get started, I think. So in today's presentation, this is a brief outline. We're going to be looking at pain. So we're going to be starting with an overview of the emotions and how that relates and interacts with pain, different types of pain and how we sort of categorize pain according to duration, why pain matters and we should be doing something about it, and then how we do that in a practical sense from recognizing pain, managing pain, and some of the ethical considerations that we need to think about when we are managing animals that are experiencing pain. So starting with animal emotions, I don't think that this will be news to anyone, but the idea of animal emotions has been around now for over 100 years, and it goes right back to Darwin and beyond, where really we considered that if we consider the theory of evolution to be a robust and accurate theory, then it makes sense that the emotions that we experience are evolutionarily conserved across a variety of species, because emotions promote evolutionary success. So often we think of evolution in terms of things like reproductive fitness and physical fitness, but actually our emotional fitness is a key part of our evolutionary success. If we didn't experience fear, we wouldn't run away from predators at a very basic level. If we didn't experience hunger, we wouldn't seek out food. So our emotions and that emotional world really drives our behaviours and confers that evolutionary success. And that is exactly the same across our animal counterparts. So emotional states have a variety of different evolutionary functions and exist across a wide variety of species, and we'll come on to talking about that in a little while. But they motivate our different actions. They lead to physiological changes. So they're associated, for example, with our fight or flight response. Emotions also influence our cognitive abilities. So our ability to learn is influenced by our emotions. If we're feeling very stressed or anxious, we are less able to learn because our body is preparing for that challenge. It's not focused on learning new information. And our emotions guide and drive our behaviours to confer that evolutionary success. And so when we think about pain has an emotional component to it, which we'll come on and talk about a little bit more very shortly. It's not just a physiological response. It is also an emotional experience, and in particular, acute pain experience has an evolutionary function, in that if we have a painful injury, we are more likely to protect that injury, to reduce weight bearing on it, or to pay it attention in terms of grooming it and tending to it to reduce infection consequences. So pain also has a functional evolutionary function. But we've not always considered pain to be something that is an evolutionary function, or even that's experienced by all animals, or even, to be honest, all people. And if we go back over fairly recent human history, actually the way we have treated other people, whether that is people from different ethnic groups or people with different cognitive abilities, it is actually really quite shocking how we have or have not managed pain across a range of different people, never mind other animal species. And I think it's worth reflecting on that, because if we are aware of what we've done before, we can do better in future. Traditionally, we've been very concerned around anthropomorphism, and that's the attribution of human emotions to animals in this context. And it was considered for a long time that the attribution of pain or emotional experiences in general to animals was anthropomorphic. And we know now, of course, that is not the case, and that there's a good scientific basis for emotional experiences across a wide range of taxa. But I think it's important to reflect on where we are and where we've come. And as we move forward and science is constantly developing, just retaining that open mind and being aware that actually we have inadvertently done harm previously by not having that open mind. So yes, we do need scientific evidence, but we also need to consider our ethical responsibilities towards others, and also just, I think, a dash of common sense when we're considering some of these experiences that have quite poor welfare experiences associated with them.
Good afternoon, everybody that's just joined us on Zoom.
If we look back just towards the 1980s, which is within my lifetime, because I'm getting old now, we can see that actually, even when we treated other humans, we didn't always give them that benefit of the doubt. And that goes to even just human infants. So the first study that demonstrated that babies undergoing surgery had better outcomes if they were given analgesia was done in 1987, and it was this study at Oxford University by Anand et al. And prior to this study being done, which showed better survival and recovery outcomes in infants undergoing heart surgery, it was quite typical that infants undergoing surgery did not receive any analgesia. They were given something called a neuromuscular blocker, which paralyzed them, and they were ventilated through that surgery, but they weren't given a pain relief to manage their pain during surgery, which, if we reflect on that is pretty shocking. But it wasn't unusual at the time, and it was because of the lack of evidence that we had. So it's not surprising, given that and the relatively recent steps that have been made towards safeguarding the welfare of human infants, that we're also, we've seen that development certainly over my lifetime, in terms of how we treat manage and treat pain in animals. And that is still an area that is developing across a wide range of taxa. So more recently, we consider animals to be sentient, and traditionally we apply this to mammals, and I will caveat this presentation with the fact that a lot of the examples I'm going to give you are focused on mammals. That is partly because of my own professional experiences, but it's also partly because of the evidence that we have. Having said that, there is increasingly and quite quite robust evidence around that pain experience and that concept of animal feelings across a wide range of taxa, certainly across all vertebrates, and more recently cephalopods, decapod crustaceans, and other invertebrate species as well, where the science is really now starting to catch up with that sentience. And I'll come on to some of the more recent developments in that very shortly.
I just wasn't sure if that was going to be high enough.
Could I just ask everyone to mute their microphones, please, just because we are getting a little bit of feedback. Thank you very much. That's really appreciated. Okay, so under the UK animal sentience law, we have captured some of those developments. And it is worthwhile, I think, just reflecting on that. It does have implications for some of our practices in zoos. So if we think about things like live feeding, obviously we don't do that with vertebrate animals, with vertebrate prey species, but with invertebrates we do, and we don't necessarily have very good alternatives to that necessarily. And there's obviously been a lot of work done in many places around looking at the welfare of invertebrates that are used for feeding and making sure that their lives up until that point are as good as they can be, and that they're managed very well. And there's a lot more sort of ethical consideration given to that nowadays than there was 5 or 10 years ago. But it is something that we do need to consider and keep an open mind of as we move forwards. There's also implications for our own ethical choices as people, potentially, if we look at things like how we cook and use invertebrate species in our own sort of sustenance as well. And there's also the consideration that if we are very concerned about these things and we're working in industries where the use of these animals is quite normal, there is the potential there for moral stress on people who are involved in that, and that's just something to be mindful of, I think. So much more recently, there's been papers around, and this paper now is 10 years old, but it's quite a really nice review paper looking at the evidence to that point of pain in a wide variety of species, including a number of different invertebrate species. So I'd recommend that as a nice summary paper. Again, individual studies have moved things along quite considerably since then as well. And then more recently, in the last sort of year or two, we've had the New York Declaration on Animal Consciousness, and a number of us as scientists have signed up to this declaration. And really, this declaration establishes that there is a consensus for and strong scientific support for attributions of conscious experience to other mammals and birds, and that the empirical evidence indicates at least a realistic possibility of conscious experience in all vertebrates, including reptiles, amphibians and fishes, and across many invertebrate taxa, including at a minimum cephalopod mollusks, decapod crustaceans and insects. And that is very likely, as we move forward with the scientific evidence, going to expand across a range of other taxa and species as well. And that confers upon us a responsibility when we are making decisions around different animals as to how we should consider their welfare risks and use that evidence to inform those risks. And that's particularly pertinent when we're considering pain, which is an aversive experience for animals. So pain is something that I think it's important to define. It's often discussed in the literature in the context of the nociceptive experience. So nociception is the stimulation of the receptors in the tissue, so in skin or muscle or any other body tissues, by an unpleasant stimulus. So it's a physiological, sort of mechanical reaction to unpleasant stimuli. However, pain is an experience that's produced by our brain as vertebrates when it processes that noxious stimulus. So it's the feelings associated with that physiological nociceptive reaction. And one of the reasons that we have sort of been reluctant to ascribe the pain experience to non-vertebrates traditionally is because they don't have brains. But we now know that they do have some of the neurochemical and neurobiological structures that actually allow them to experience or potentially experience pain in a way that is potentially similar to how we as vertebrates experience pain. So just because their structures are different, they don't have quite the same neuroanatomy or neurophysiology, it doesn't mean that they're not capable of the same experience in a different way. So a painful experience is a combination of that noxious stimulation of the tissues, that physiological adverse stimulation, and then the processing of that stimulation in us as vertebrates by the spinal cord and the brain, by the central sensory mechanisms. And the important thing about pain is that it's not just a physical experience. That emotional component of pain is really important, and particularly when we look at things like chronic pain. So it's the unpleasant feelings associated with pain that cause the suffering. So pain's not just about how it feels at the moment, it's about how it makes you feel in general. And if anyone in the audience has experiences of chronic pain, back pain in people is quite a common form of chronic pain, then you'll know how debilitating that can be, and it is associated with emotional states of anxiety and depression. So there are different types of pain, which we're going to run through quite briefly, and there's some terminology associated with this, so apologies, but it is important to think about when we think about how we treat pain. We need to know the type of pain that we're dealing with. So nociceptive pain is a type of pain that's caused by damage to body tissues. So that's our pain associated with injuries. So if you cut your finger or you stub your toe, that is nociceptive pain. Neuropathic pain is caused by damage to the actual nerves themselves that transmit that pain. It's often described as a burning or a tingling pain, sometimes a heavy sensation or a numb sensation. And we see this with spinal cord injuries or post-amputation with phantom limb pains, or sometimes with nerve damage due to things like diabetes. And then we have inflammatory pain, which again, a lot of you will be familiar with. And this is when we get a release of inflammatory mediators. So this is the pain associated with redness and swelling. And so when we get that inflammatory response, that's the type of pain we get with this. And we can see that sometimes with some immune-mediated diseases like rheumatoid arthritis or inflammatory bowel disease. But we also get that sometimes in conjunction with nociceptive pain. So if you get an injury, if you cut your finger, or you get a paper cut, I think that's quite a good example, you get that initial sharp nociceptive pain, and then a few minutes later, when you get the redness and swelling, you get that inflammatory pain associated with that. So we can get different types of pain that occur, in response to the same injury or the same insult. So just a little bit of quiz on I don't need you to sort of type or shout out, but just have a think to yourselves about what type of pain this would be. So this is a wound in the side of an animal. And this would be nociceptive pain from the original injury. And then we'd very likely get a secondary inflammatory pain, so redness and swelling associated with that injury, that fighting injury. So dental disease, we would get nociceptive pain associated with in this case, it has been a damage to the teeth, so broken teeth that you can see there. And then we'd get inflammatory pain as the nerves and the pulp and the sensitive center of the teeth is exposed and becomes inflamed. And then as those nerves continue to be inflamed and damaged, we may well get neuropathic pain associated with that. So we often think of dental disease, it's very common in a lot of the large mammals that we deal with. It's almost becomes a sort of, a fairly common disease that, and because animals don't often show a lot of behavioural signs associated with it, it can be overlooked. But actually it's quite a complex pain experience for them, and it can be very, very severe. And then these are some X-ray images of different joints. So you can see the diseased joints on the left and the healthier joints on the right. So you can see those comparisons across them. And the diseased joints are much more furry. You can see that osteoarthritis developing in those joints. And again, there'll be some nociceptive pain associated with that injury and disease to those joints. Very likely inflammatory responses in those joints, and we get that chronic inflammation, and potentially also neuropathic pain as the nerves around those joints, and particularly in the spinal example at the top, we can get impingement of the nerves and pinching of the nerves as that bony arthritis squeezes them as they exit out of the spine. And it's important that we understand the different types of pain, because often when we're prescribing pain relieving medication, that medication might only work on one of these types of pain. And so sometimes we prescribe pain relieving medication and it quote unquote doesn't work. But actually, that's sometimes because we are not prescribing the correct combination of drugs to address all of these different types of pain. And we'll come on and talk about that a bit more later. We also categorise pain by duration, so acute versus chronic pain. Now, I mentioned earlier, acute pain is protective. It has an evolutionary function. It prevents us from further damaging an injured area of our body, but it reduces relatively quickly. Now, where we get problems, and particularly problems with our animals, is in chronic pain state. So chronic pain is a pathological state, and it's usually associated with degenerative disease or longer damage to the nervous system. And chronic pain is something that doesn't confer any kind of benefits to animals from a survival point of view. In fact, it's detrimental from an evolutionary and survival point of view. And it's one of the reasons that a lot of our animals might not live as long in the wild as they do within the managed zoological environment. And that's because they develop this degenerative chronic pain relating to joint disease or dental disease or whatever it might be, and that will impact on their functionality, their physical fitness out in the wild, and often that makes them vulnerable. I just want to flag as well the Chronic Pain Symposium, which is run by Canine Arthritis Management. So this is a free online event. It's coming up next weekend. You can find it just through Google. This is what it looks like. So sorry, it's in a couple of weeks' time. It is a really great symposium with expertise on chronic pain management. It is focused on companion animals, so primarily dogs, but also cat species. But a lot of that information is translatable to the zoo context or potentially useful for zoo and exotic animals. So just wanted to mention that as a potential resource. Like I said, it's free to sign up for, and it's fully online and flexible. So we'll look first at acute pain and what that feels like, or what the pathways are around acute pain in terms of how we experience that. So what happens with acute pain is that we have what we call a noxious stimulus, which is just so that might be an injury, it might be a cut, it might be, just something that's damaged us in some way. That experience is processed by those receptors, and so by the nociceptor, and then it is transmitted by the nerve fibers into the spinal cord. The spinal cord then processes that, and it goes up through the nervous system, through something that we call the ascending pathway, into the brain, and the brain processes that experience, and that's where we get the emotional component of pain. The brain says, right, okay, yep, I understand that this is painful, and it sends out chemical signals that then reduce that pain communication from the spinal cord. And this is called the descending pathway. And this is why when you cut yourself, you'll get that initial sharp pain, and then very quickly that pain experience reduces. And that's your descending pathway kicking in to say, yep, okay, we know this is sore, but we don't need to keep knowing that it's sore. So we can stop those signals now. What happens sometimes is if that pain persists, or for example, during a chronic injury, so something like dental disease, or for example, during surgery where an animal is anaesthetized, but we are, deliberately causing injury, because surgery is, we're causing tissue damage there. So we're persistently causing tissue damage over a period of time. If we don't give pain relief, if we don't give analgesia during that process, then we can get a response that we call wind up. And what happens during wind up is that we get that initial injury from the tissues, and that goes is sensed by the receptors and is transmitted to the spinal cord. That goes up to the brain, and then the brain says, okay, got that, understand that something painful is happening, let's try and reduce that experience. But that injury keeps happening, so we continue to make our surgical incision, or if in the case of sort of chronic pain, those signals just keep coming, it's still painful, it's still painful, it's still painful, then what we get is a chronic activation within the spinal cord. We get some changes in the mammalian spinal cord, which then mean that we can develop those pain signals keep firing, and this can actually create a chronic sort of neuropathic pain experience for us. And this is why if we don't use pain relieving medications prior to a surgery, animals will wake up in a lot of pain. So even though they were unconscious during the surgery, when they wake up in extreme pain. And that's because of all of this physiological activity that's happening, even though the animal is unconscious. That pain processing is still happening. And they wake up in this very sort of fired up, their nervous system is very fired up. And so what happens there is that we get those pain signals that keep going. We get that firing up, that chronic dorsal horn activation, and then what happens then is that essentially the descending pathway just stops working because it just can't function against all of those pain signals that are chronically coming. And if we think about things like osteoarthritis, well, we're getting that constant messaging of pain every time we use a joint, or dental disease, if we've got an infection there, there's just pain every time the animal moves its mouth or tries to eat or does anything, then eventually that descending pathway just essentially gives up and can't manage that constant messaging that's coming from the receptors. It just becomes overwhelmed, and we get this chronic pain state. And that's why chronic pain is so debilitating. It's just that there is no real physiological mechanism for managing that. And there are lots of different things that can cause chronic pain in animals. So common things that cause chronic pain are, as we've mentioned, osteoarthritis, dental disease, anything that affects nerves, so any kind of spinal conditions or disc prolapses or compressions. Cancer and tumours can cause chronic pain. Chronic skin conditions, so some of the allergic skin conditions can really cause chronic pain, and that's something that's often overlooked. And then ear disease, eye disease, anything where we've got kind of a sensory component to it, that can also be a chronic pain issue. So again, just flagging, if you want to learn more about that, the Chronic Pain Symposium is happening later this month. So why does pain matter, and why should we do something about it? Well, in our animals that we manage, pain can result in behavioural changes that can be problematic. So I would hope we would want to do something about pain because we know it's a negative experience for the animal, but it also changes the animal's behaviour. So it can change an animal's foraging behaviour, it can change its social interactions. We can see increased hiding or social avoidance behaviours. We can see increased aggression within a group or towards keeping staff. And we can see abnormal behaviours developing as well. So self-injurious behaviours or abnormal repetitive behaviours, stereotypical behaviours, can all occur as a result of pain. So just an example of that, this is a bear that was holding her face repeatedly under a waterfall and sort of blowing bubbles. This was originally misinterpreted by her keeping team as playing behaviour, but she would spend long periods of time doing this. And when I was sent this video, to me, this is an animal that is managing pain. And I sort of said to them, can you see in her mouth, do you know what the inside of her mouth looks like? And they did train her for an open mouth behaviour, and you can see her canine teeth are just broken and sort of missing. She's got quite a lot of dental disease in there. She did have dental treatment, and after the dental treatment, she stopped performing this behaviour under the waterfall. And I think what that behaviour was her just numbing her face under the cold water because her face was painful, and she'd learned that if she held it under the cold water, she could numb out some of that pain. And that was actually an abnormal repetitive behaviour that she was seeking out some solace from the pain. But there's also some studies done looking at things like stereotypical behaviour, pacing behaviour, head swaying behaviour. So if you have animals that are displaying abnormal repetitive behaviours, it's really important that we examine them for any painful conditions that might be triggering that behaviour. There are also physiological responses to pain, so we can get changes to the cardiovascular system. We can get impaired gastrointestinal function. With acute pain, we can get reduced respiratory movement. So if we have animals in a hospital environment or recovering from surgery, we need to be managing their pain for all of these reasons as well. They can retain their urine and not want to go to the toilet if they're very painful. And pain is stressful, so we get a cortisol response associated with that as well, and that can impact on the immune system longer term. And then in terms of the psychological impacts of pain, often we get anxiety associated with pain. Animals are less able to concentrate or focus, so they might be less responsive to trained behaviours. They can be restless and agitated. They don't sleep as well, and obviously that has impacts on their social behaviours and their psychological functioning. Alternatively, we might get what's seen as excessive rest or hiding. It's often not true sleep, but they might be seen as being more sleepy than usual. And then we get those abnormal behaviours as well that we've already touched on. So it's worthwhile recognising that as well as that increased sort of activity, that abnormal repetitive behaviour associated with pain, we can also get a normal behaviour that's performed excessively, and that resting behaviour in response to pain is quite common. So in our geriatric animals, as they get older, we often consider that, they just slow down. Now they're generally slowing down because of muscle stiffness, joint disease, or reduced cognitive ability. So it's important that we're aware of that. We want to be maintaining those normal behaviour patterns for as long as possible in our geriatric animals, keeping them active, keeping that muscle development and that cognitive activity for as long as possible to ensure that they are experiencing good welfare. So we've covered a lot of this, I think, but it's just to say that pain has multiple consequences in terms of physical fitness, but in and of itself, the reason that we should be managing pain is because the consequences of unmanaged pain are pain, and pain in and of itself is a really unpleasant experience. I'm sure we can all agree on that. Just to touch on sort of some of the severe neuropathic diseases that we might get, so things like spinal disease. It's just to say that an absence of pain can also be a welfare problem. So this is an animal, a bear with a spinal disease. That means she has an absence of pain. She's not feeling anything in her hind limbs because she's paralysed, and that obviously it has welfare consequences as well in terms of abrasions, ulceration, and injury. So pain does have that protective physiological function, and so a total absence of pain is also problematic from a welfare point of view. So we need to be familiar with an animal's normal behaviours and responses so that we can identify any changes that may indicate pain. And this is where things like our welfare assessments are really important. There's some really nice examples within the EAZA Welfare Assessments library. And what we want to be doing is assessing the welfare of animals when they're young and healthy and displaying normal behavioural repertoires, so that we have that baseline, that benchmark, that we can then evaluate any changes as that animal gets older. We can say, actually, this behaviour has stopped or this behaviour has started. Is that possibly an indication of pain? And that's really our first step in terms of identifying pain and therefore managing pain, rather than waiting until that pain is really severe. We know that for a lot of our species, they don't demonstrate overt signs of pain until it's pretty significant. So if we can pick up on those more subtle behavioural changes earlier, we can manage their welfare much better for longer. So this is one of my favourite quotes associated with pain. We all experience pain. We're all familiar with that pain experience. We can't avoid pain. Pain is inevitable, and in some cases it can be protective. But the suffering associated with chronic or unmanaged pain is optional, and we have the power really to manage that for the animals that we're responsible for, and that's what we ought to be doing. So I'm just going to give a couple of very brief examples because we are short for time, but this is just a couple of examples of how tricky it can be sometimes to recognise pain. So this was an American black bear that I was involved in. She'd woken up from her winter torpor. Her appetite had remained poor. She'd lost weight. she was housed in a facility that wasn't brilliant, and so it was tricky in many ways to sort of understand her behavioural repertoire, because she didn't have access to a lot of things that we might want her or expect her to have access to. But the keepers had also noticed one episode of this head pressing behaviour that you can see her doing against the wall, which is quite abnormal. And then if we can play this video, hopefully, yeah. So this is quite a subtle video, but she started doing this for quite long periods of time. So you can see she's standing, and it's quite a panty sort of behaviour. You can see her respiratory effort if you look at her abdomen and her whole body. She's standing quite rigidly. She's not really doing very much except this sort of huffing, panting behaviour. And in some of our larger carnivores, this can be a sign of pain. This is the behaviour where she's quite rigid. She's not really wanting to move. It's not a normal behaviour, and that respiratory effort sort of suggests pain. And she actually had an abdominal tumour that had spread, and that was causing her internal pain. So that's why we were seeing those behaviours, and that was eventually found. So these signs can be quite subtle. Similarly, this is a lion. This lion was behaviourally quote unquote normal according to the keepers. She was navigating her enclosure, she was in a social group, she was feeding, she was doing all of those things, but she has a blinding eye disease called glaucoma that we know is excruciatingly painful. But because that has a gradual onset and is a very progressive, slow disease, the keepers in this institution hadn't really noticed a change in her behaviour. So even though her eye disease was very severe and would have been very painful, they were seeing that she was navigating okay, because nothing in her enclosure changed, so she was able to just move around. From her memory of what that was like when she was visual, she was already established in a social group, and that hadn't really changed, and she was able to find her food, obviously using her sense of smell and her ears. And so her eye disease wasn't really being managed, and the pain associated with that wasn't really being managed at the time because of that slow progressive change. So this is where your benchmarking from young healthy animals is really important, because her behaviour had changed, but it was subtle and it was progressive, so it hadn't really been noted over that time. Okay, so what can we do about pain? We want to minimise that physiological pain transmission. We want to try and prevent that central nervous system activation and sensitisation, and that progression into that chronic pain state. And that means that whenever we know there is a preventable or a predictable experience of pain, we should be taking proactive steps to prevent that pain transmission. And that's why we give pain relieving medications before surgery, is to block that nociception and enhance the body's natural analgesic mechanisms. This helps to ensure adequate healing of that damaged tissue after surgery. It's more difficult, obviously, if we have a spontaneous injury or a chronic disease like arthritis. We can't do that preventative mechanism. There's lots of different drugs available. I'm not going to go into those in any detail. And there's more recent progress into things like anti-nerve growth factor, monoclonal antibodies. Some of you may be aware of, and I am aware of, some situations where these are being used in zoological species. Now, they shouldn't work in zoological species because these are species-specific antibodies. So you might be familiar with some of the trade names. So Librela is the one that's used in dogs, and Silencia is the one that's used in domestic cats. Because they are antibodies, they're species-specific. They bind to the nerve growth factor in the body as an antibody reaction, and they decrease the signal, the pain signaling in the cell types that are involved in that pain communication. There are potential risks with using them across other species because they are an antibody. There are the risks of immune reactions and responses to them. So I think it's important to be aware of that. And again, there's some good resources in companion animals that can give you more information on the different therapies that can be used from a medical point of view to treat pain if you are interested in that. So I'd recommend the Zero Pain Philosophy website and also the Canine Arthritis website as really good resources for accessible information on different medications and other management strategies that can be used for managing pain. So the way that different medical management of pains work is at different steps along this pain pathway. So our non-steroidal anti-inflammatory drugs, things like Metacam, Meloxicam, those kinds of drugs that you might be familiar with, work as an anti-inflammatory. So they work at that local site where the injury happens. Our local anaesthetic drugs, so our lidocaine or bupivacaine, they actually block the transmission of that noxious stimulus via the nerves to the spinal cord. So they're a really effective pain relief because they totally block that experience. So they're really useful during surgery to stop that pain transmission from happening. Some of our medical drugs are ketamine and amantadine, alpha-2 agonists, so which we often use for anesthesia. So things like medetomidine or xylazine or dexmedetomidine, they work on the spinal cord as well. And then they also work on enhancing that descending pathway that we talked about. So they promote that. And that's also similar for our opioids and tramadol in the species where tramadol works. And there's varying evidence for that, and paracetamol as well. And then some of our psychotropic drugs, so some of our antidepressant drugs and some of our other anesthetic and analgesic medications also work centrally in the brain. So what we want to try and do when we are managing pain is use lots of different types of these drugs at different steps along the pain pathway at lower doses. Because by using multiple different drugs that work on different levels of the pain pathway, we have a much more effective pain management technique, and it's much safer because we're using lower doses of each drug as well. So it's more effective and it's safer. The other thing that I think is really applicable in the zoo world is environmental enrichment and environmental modification for pain management. And there's a really good evidence basis for that, starting from many years ago back in laboratory animals, and then much more recently, even in people, they've looked at chronic pain and depression and anxiety disorders associated with that. So we know that having an enriched environment, a good life, good social experiences, lots of fun things to do, spending your time doing things that you enjoy and that are interesting, all of those things can help with chronic pain states. And that's really pertinent, I think, for our older and geriatric animals. So that's not just giving enrichment. It's not just giving a thing for an animal to do. It's thinking much more holistically about the animal's quality of life generally, how it spends its time, and making sure that the animal is engaged in a wide variety of enjoyable, positive welfare activities. And that can really boost mood and moderate that experience of pain. So if we think about things we might want to consider, that might be the social grouping, enclosure design, operant conditioning programs, enrichment provision, a whole variety of things. But we also need to monitor those things as our animals, particularly as our animals age and experience these degenerative experiences, because they're also useful for us to be able to, again, detect that pain and assess whether the animal is experiencing pain by looking at changes to the animal's activity, to its social grouping, to how it's coping in its environment. So we need to consider holistically that animal's pain experience and all of the different things that we might need to do in order to manage the animal's pain, including management of any additional diseases that it might be experiencing, diet, activity, social grouping, etc. And that can be quite a challenge and does require quite a lot of resources if that is the route you are going to go down. So it's really important that we have an ethical decision-making process for that in order to ensure welfare, but also to ensure that we are using the limited resources that we have effectively, and that this is a good and justifiable use of zoo resources. It's not acceptable to leave animals in pain without effective, appropriate, holistic management as they get older. But equally, it might not be viable to be able to manage that animal's pain effectively. And so we do need to think about decision making around that, and making sure that we do have appropriate ethical decision making for assessing, managing, and making decisions around quality of life where the animal's welfare is negatively impacted. So we do need to think about all of those things in the context of our pain management.
About 5 minutes left, Heather.
Thank you. And additionally, we need to think about that wider role of the zoo as well, and those conservation resources. Are those geriatric animals serving their purpose within the zoo environment from an educational ambassador point of view? Or could that resource, that space, be allocated to species that perhaps have a stronger conservation view? And this will vary from institution to institution. It'll vary between different zoos, and if you're coming from a sanctuary environment, that decision making will be different again. And none of that decision making is right or wrong. Different things will work differently in different contexts and for different types of organisation. But what's really important is to have discussions around what those priorities are. Are they conservation? Are they animal welfare? Are they a mixture of both? How do we achieve those objectives in order to ensure that we are and safeguarding the welfare of our animals? And this has been something that we've battled with for a long time. So, this paper's 20 years old now. This is Andrew Kitchener's paper and Alistair MacDonald's paper on the longevity legacy and the problem of old animals in zoos. We've had work done looking at euthanasia decision making and pathology in zoos, and we're still, even now, I think, battling with that. I think we've come a long way in the last 10 years or so, and I think we're much better at that. But I think we do need to be mindful that euthanasia is a perfectly justifiable way of managing pain in animals, where that is appropriate for the animal and the institution. So I think it's just tying up all of these different ethical considerations and making sure that we are managing the animal's welfare adequately, and not ignoring those behavioural changes, or if we don't have the resources and the it's not a reasonable thing for us to do very advanced geriatric management. Managing well-being in aging animals in particular, pain management is an area that has developed significantly over recent years. And I just wanted to flag this book, partly because I have a chapter in it, but there's some really good work in there around things like physiotherapy and euthanasia decision-making and a lot of different things. And the nice thing is it goes across a range of different taxa as well. So it's really looking across all of the different zoological species and what we can do to manage their welfare in those different contexts. So I just wanted to flag that. But I guess in summary, pain is an illness certainly experienced by all mammals, and I would argue by a large range of all vertebrates, and by a wide range of non-vertebrate species as well, I would argue. There is some pain that is predictable, so things like surgical pain we should be treating proactively, and that's how we should be managing that. But for our unexpected pain or our degenerative pain, we do need to be assessing that, evaluating the impact on that animal, and making sure that we're managing it as best as we can, as much as possible. And if we're not sure if an animal is in pain or not, we should be applying that precautionary principle and treating and managing that as best we can, and just trying it to see if that makes a difference to that animal. So thank you very much. Really appreciate your time today.
That's fabulous. Thank you so much, Heather. Brilliant talk. We've got some questions coming in. So I'll kick off with this one. So with the polar bear video, where it was showing repetitive behaviours under the waterfall, the question is, why did you initially think that the repetitive behaviour was linked to a medical issue rather than a behavioural issue such as frustration or boredom? Was the behaviour new? Did it appear overnight, or was it something you'd seen before?
So that's a great question. So my answer to that would be that and this is maybe because I've got veterinary training, but around, certainly in companion animals, around 60% of behaviour problems that we see at referral level are associated with pain. So the vast majority of behaviour problems in our companion animals are due to undiagnosed pain. And that's very likely to be the same in other contexts as well. So to my mind, pain is something that we can treat and we can rule out quite quickly. So it's, to my mind, if it's pain until proven otherwise. So if I have an animal with a repetitive behaviour, I would want to do a full health check or at least a sort of a visual assessment of that animal. So things like teeth is very common in bear species. So to my mind, it just seems to make sense. So that would be my first thing, is I would want to rule out any potential painful condition, and potentially also do a medication trial initially. So if I'm not sure if pain is a contributing factor, I would probably trial that animal on a pain relieving medication and see if that had any impact. But certainly if there's a potentially diagnosable illness like dental disease, which you can see very clearly, then look for common things first would be my recommendation.
Amazing, thank you so much. So we've got another one. What do you recommend to do when you've established a baseline assessment of an animal's quality of life using several welfare indicators by assessors, but the assessors may adjust their assessment over time, even though the animal's condition may deteriorate? So actually what you see is that they are lowering the threshold for scoring of optimal.
Yeah, that's a really great question as well, and we do see that happening. So there aren't a lot of them out there, but we are starting to see some validated pain scales for different species. So I've worked on one on bears, which is freely available, if anyone wants to find that. But so and ideally for those validated scales, what they show is they should be objective enough that they are reliable between different assessors, but also they're reliable the same assessor over time. So you're looking at actual measurable things that the animal is doing or not doing anymore that then allow you to demonstrate that measurement. So they are more difficult to sort of fudge in that way. Whereas if you're asking general questions like, is the animal still active? Or, that's something that it's not so specific, it's not so measurable. So ideally you want to be using those sort of measurable indicators that you can track over time more objectively. And there are different ways of doing that as well. The Animal Welfare Assessment Grid allows you to do that. There's other apps and lots of different resources that allow you to do that. Otherwise, I think the second part of that is staff training, colleague training, and having a bit of a discussion group around table, and trying to cultivate a team where you can have some of those difficult conversations. And they are very difficult and it is hard. So I'm not belittling that by any stretch, but just to try and sort of say, okay, well, actually this animal has changed its behaviour. We all agree that, and the likeliest reason for it to have changed its behaviour is pain. Let's do a trial. Even if you're not sure, let's try a pain relieving medication and see if that makes a difference. And if it does, that gives us a good indication that this animal might be in pain. If it doesn't, then we can look at other things. But at least we've ruled that out and we've kind of safeguarded that from this animal. So I think a lot of it is just trying to have those conversations. And I do recognise that can be really difficult to bring people on that journey, particularly when you're moving towards a euthanasia decision making. And there's an emotional component to that. That's really hard.
Yeah, absolutely. Thank you. Just got a question here. Linda, sorry, I've not had a chance to ask you, but do you want to come on and ask yourself, or would you like me to ask this question for you? Okay. So the question is, have you experienced cases like the polar bear where the pain was managed, but the behaviour continued and was possibly then a learned habitual behaviour with no clear cause for it?
Yeah, definitely. So pain can sometimes just be a component of an abnormal repetitive behaviour. So it's always worth ruling that out and treating it where there is a treatable option. But yes, you're absolutely right. Chronic pain can cause changes in the brain, just as chronic frustration or chronic stress can cause those same changes. And that means that we get behavioural persistence, and that behaviour persists even when you remove the original problem. So it's just the same as if we have an animal that comes from a deprived background or a non-ideal background that is frustrated and it develops a stereotypy. Even if we then put it in a really enriched environment, it may well reduce that stereotypy, but that stereotypy may well still persist. And it's the same with chronic pain. And once you get those changes, those neurobiological changes in terms of the wiring of the brain, it can be very difficult to totally eliminate that. So then what I would suggest is what we should be looking for as our markers for welfare are not elimination of that behaviour, but proportion of time spent in it and triggers for it, if we can identify those. But also, what is the animal doing when it's not doing that behaviour? So does it have good social interactions? Is it foraging? Is it climbing? Is it doing all of the positive welfare indicators? Some of the, the things that we know the animal enjoys. Is it interacting with enrichment? Is it playing? Is it doing, some of those behaviours that we know are indicators of positive welfare? And is it spending more time doing those since we've treated the pain? And very often the answer is yes. It's spending more time in those positive behaviours, even though it's still doing a bit of the abnormal repetitive behaviours.
Amazing, thank you. We've just had, I didn't have time to ask, but Rodrigo, do you want to ask your question, or I can read it out? I can read it out. So I know you said that you're more experienced with mammals, but if a bird, pelican, for example, had surgery, but the behaviour is the same, but the vets keep recommending painkillers, however, so behaviour is the same, but the vets are recommending painkillers. Is there anything that you think the trainers might be missing that the vets are seeing, which means that they're recommending the painkillers at the same time as the people doing the behavioural observations are actually thinking that maybe it's further along than they think?
Yeah. Very difficult to answer on a specific case without all of the information, obviously. So, but what I would say is that sometimes this is just a communication issue between people or teams rather than, and maybe there's not an equivalent understanding of the situation between everyone. So it may well be that the vets are seeing or have an understanding of that condition being progressive and therefore are safeguarding the animal's future welfare by maintaining it on pain relieving medication. I guess I would, just from a logistical point of view, suggest that if they're spending the money and resources on prescribing the pain medication, there's usually a good reason for that. So unless you're concerned about side effects or administering the pain relief is very difficult or stressful, then maintaining that pain relief is probably a good thing to do. But it really does depend on all of those things. If it's easy to give, is it stressful to give the medication, and I think that is where it's really important to have these conversations between the vet team and the keeping team to make sure that it's the best solution for everyone involved in the care of that animal and also for the animal itself, of course. So yeah, I think a communication and talking between the different teams is really important there.
Lovely, thank you so much, Heather. Conscious of time, so I think what I'll probably do is wrap up now, but if anybody does have any more questions that we've not got to, then please do get in touch with Heather. And if you want access to those resources, I'm sorry, I couldn't quite keep up with all of the links. So if you want access to any of those resources, please also just either Google, obviously, or get in touch with Heather, especially about like the bear pain things as well. Thank you so much, Heather, for your time today. We really, really appreciate it. There's been lots of really positive comments in the chat, and hopefully you can see those now. But yes, thank you for joining us.
Thank you very much for having me.